people who get single implants done, there's different ways to restore them. And so it's worth asking when you are getting it done from a dental office, kind of what their methodology is a little bit. Make sure they have a great lab they work with. There's different restorative options.
Yeah, that's a great point. I think technology, you also want somebody that doesn't do an implant like once a month. You want someone that it's a regular part of their practice. And if you walk in the office and they don't use 3D imaging, digital 3D imaging, in 2024 it's probably worth looking around and finding someone else that's a little more versed. Most offices are using 3D intraoral scanning at this point to have the final fabricated, which we find brings a lot more accuracy. It's also a lot better patient experience.
Oh, 100%.
Having the goopy impressions, those suck.
They're the worst. Yeah, and now you can come in, it's such a smooth process, it's really comfortable. Patients love it where you come in and we wave a little wand around that stitches all the images together, which makes it a really pretty smooth process. And those, who've had the big tray, metal, plastic tray in the mouth, gets in their hair and on their face, versus what we can do now. It's more accurate, there's no warping, it's way more comfortable, and we get great results. My favorite is when we put the final crown in, hand you a mirror, and you can see it just blends right in. You treat it like another tooth, you floss it, you brush it, it just behaves much like a tooth that you had before.
Well, and like Seth said, a lot of the patients don't really care to know how the sausage is made, so to speak. They just want a nice final result that's going to last and work well for them. But we have kind of been in the weeds on that. Started a digital dental lab in 2018, and we've been involved in both sides of the process since then. And that's been super cool to see the advancement in a relatively short amount of time in the last 6 years. We had one of the first 3D printers in dental, and now that's a huge part of the process, the digital imaging and scanning, and also the CAD/CAM applications on the back end have just made it come from a kind of an artisan lost wax technique is where we started with casting and all that. And now being a digital process, it's just a lot less trial and error, so much more accurate. And in our practices, the cost has actually come down because of the streamlined digital workflows. We're able to pass that cost on.
It's come a long ways. I mean, to toot your horn a little bit, you're over there working at the OHSU as an adjunct faculty, helping with the digital workflow over there, so they can also, when we were back in school, we were casting gold and broken arm technique and this whole thing, where now we're actually been asked to come back in, show them how to use the digital workflow, which has been a big deal. How to design, how to print, how to do try-ins, which is it's a whole new digital world, which when this technology is applied in the right way, you get great results. It looks really natural, they feel great, they look great. Aesthetically, it's just really important to get it right.
Yeah, and it is crazy, right? We're just over a decade out of school, and the landscape is completely different. When we graduated, in 2013, how things are done then and how they're done now. It's an exciting time, I think, to be in dentistry for that reason, is we do have a lot of great tech that ultimately, for the patient, just becomes less expensive, less time, less appointments in the office, less time at those appointments, and then just less uncomfortable, really.
Sure.
With all the try-ins and the goopy impressions and all that stuff that we've now ditched.
What cell phone did you have when we were in school?
Yeah, I mean, that was pre-iPhone, right?
I think I had a slider. It was awesome. It got pretty good at the old keypad.
Yeah, well, iPhone had just come out, but we couldn't afford it.
Back then, that's right. Yeah, it's very different. But you look at the tech then, you look at the tech now, and same thing trend, with the technology and dental. It's just the same thing. It's just gotten better and better. And so now you look at what you can do on your phone, you look at what you can do in dentistry. And so I think that's important as a consumer, as someone who's going to get this done, that you're not stuck in the era of, a slider or someone. You want someone who's current, who has the best technology, because you can get a better result. And it really, you can see the difference if you have some of that old technology. It really just stands out.
Yeah, that is interesting, right? I think if I were to go get an implant done, I would want to find somebody that was experienced. You want to be the guinea pig, so to speak. But you also don't want the guy that's done everything the same way for 35 years, because we see that too, and that's so I think there's definitely a sweet spot there, right?
There's
Where
a sweet spot.
someone who's up on the technology, knows the process, detail-oriented,
That's right.
patient-focused, obviously, but has that blend of experience and technology.
Yeah, it makes a big difference. I agree.